I will call the Wednesday, January 4th, 2023 meeting of the Health and Human Services Committee to order. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We'll move on to public comment. I don't believe we had anybody signed up for public comment. Kelly, did you have anybody? No? Okay. Item number 4, approval of the November 2nd, 2022 Health and Human Services Committee meeting minutes. Those were in your packets. Do I have a motion? Okay, motion by Niemeyer. Is there a second? Second by Covelli. Are there any comments, questions, discussion? All right, seeing none, all those in favor of approving the minutes, say aye. Aye. Opposed?
Aye.
Okay, motion passes. Item 5, policy issues, discussion, and potential committee determination. We have none. 6, operational functions required by statute, ordinance, or resolution. Also none today. So that brings us to 7, educational presentations and committee discussion. 7A, nurse-family partnership implementation update. And we have Laura Scuderi from the Health Department with us.
Okay, thank you. Thanks for having me today. I've been asked to come and give an update about where we're at with NFP. So, and I'm going to be referring to it as NFP. It's the Nurse Family Partnership. I just want to go through quickly a few key points. According to the National Counties Association, the first 3 years of a child's life are considered the bricks and mortar of brain development, building that foundation for future learning, behavior, and health. Evidence shows that when we invest in the early years, infants and toddlers become healthy children who are confident, empathetic, and ready for school and life. Communities and governments can provide parents with the support they need to succeed and thrive. So that's from the National Counties Association. That's a direct quote. Funding and supporting early childhood programming, including prenatal and postnatal services, is a common function of county health departments. Counties provide early childhood or prenatal support to over 16 million children in the United States annually. Prenatal and postnatal home visiting programs have been proven to reduce rates of smoking, decrease emergency room use, decrease infant mortality, decrease pregnancy-induced hypertension, increase moms' attempts at breastfeeding, decrease a parent's dependence on Medicaid, decrease overall costs on Medicaid, and also decrease childhood language delays. As of this month, Marathon County Health Department no longer operates the Start Right program, and we've switched to the Nurse Family Partnership. The Nurse Family Partnership is a voluntary, accredited home visiting program that supports low-income, first-time mothers and their babies by assisting parents to increase their parenting and life skills. Specially trained registered nurses provide support, advice, and education on diverse topics regarding child and maternal health, development, and care. Visits to families begin during early pregnancy and continue until age 2. To date, NFP is replicated in 40 states and 8 Wisconsin counties, including Dunn, Chippewa, Eau Claire, Juneau, Adams, Sauk, Dane, and Kenosha counties, and now Marathon. So in Wisconsin, NFP has served over 2,650 families since 2007. So the goals of NFP are to improve pregnancy outcomes by helping women engage in good preventative health practices, to improve child health and development by helping parents provide responsible and competent care, and improve the economic self-sufficiency of the family by helping parents develop a vision for their own future. So NFP has had more than 40 evaluation studies, including randomized controlled trials and large-scale replication data. According to the County Health Rankings evidence rating, NFP gets the highest rating, indicating strong scientific support, citing long-standing evidence, and they highlight the following outcomes. NFP mothers have more stable partner relationships, enhanced parenting skill, and are less reliant on welfare. Participants are less likely to deliver their babies preterm and more likely to initiate and continue breastfeeding than non-visited mothers. Participants engage in fewer risky behaviors with less substance abuse during pregnancy and experience less impairment to parenting due to substance abuse. NFP appears to reduce mortality in both mothers and children over the long term as well. So NFP also has a clearly scientifically proven return on investment. This was a study that was done, and it saves about $60,428 per family served. The county board approved NFP with the budget, but reduced the funding by $140,000. The reduction of funding was a challenge, but we had budgeted that funding to provide to Children's Wisconsin for transitions in care between families receiving Start Right services and NFP services. The Start Right program used to contract with Children's Wisconsin for specific Start Right services and for families, and we have since ended that contract as of January 1st. Children's has expressed that they are looking for funding to provide home visiting services for families, and they're currently seeking out those funding streams. I want to emphasize that this year is going to be a pilot year for us, which means that we are learning a new program and implementing it from scratch. So we do not expect to be fully operational from day one. The nurses need to be trained in accordance with the model, referral and tracking systems need to be established, Medicaid billing systems need to be updated, and we need some time to get operating at peak efficiency. So we expect to see about 50 families this year, but we will be able to double that in future years. I want to emphasize that this specifically because the value of the program should not be weighed by this first year. The board has established that this service is a benefit to our community, and the board has already saved over $500,000 in this first year alone with this model change. It's estimated that we will save the county even more next year, as we will not have additional startup costs. So in order to give you a clear sense of what NFP does, I want to do something a little different and do some case studies with you. So I will need 3 volunteers who will read cards for me and become NFP mothers for a few minutes. Okay? All right. Okay. You can take one? Awesome. Okay. And I see you raise your hand. Great. There you go. All right, Jennifer, would you mind reading your card for everybody?
I am 14 years old and I got pregnant when I ran away with my boyfriend in October. I have difficulty getting to and from doctor's appointments because I can't drive and my mom won't always take me. My parents are unreliable. They drink a lot and are frequently gone for days at a time. I don't drink much, but I regularly smoke weed because it helps me with my stress. My parents say that weed is natural, so it's okay to smoke it. How can nurse-family partnership help me?
So I want to mention that these case studies that we put together today, while they're not exact replicas of what we've seen, they are compilations or similar to things that we see. So it's not going to be, direct confidentiality breaches. What it is basically that we're putting together information for you so that you have an understanding of what we see for nurse-family partnership. And so that is an example of what we would see. So what nurse-family partnership would then do is we would build trusting relationships with that teen so that we could coach and coach them and make sure to share resources. These relationships really last for 2 years. So we can do some intensive case management with that teenager and their baby. Case management means that we teach about substance use, mental health, parenting, and then we provide resources and eliminate barriers to those who are receiving the services. Nurses collaborate with parents, school counselors, medical providers to make sure that the mothers and babies get services that will produce better outcomes. So the health department nurses troubleshoot issues regarding transportation and ensure that the teen has access to the appropriate doctors and prenatal care. Some services need to be coordinated, including referrals to social services, the neighbor's place, obstetricians, counselors, psychiatrists, and WIC, just to name a few. These interactions with nurses break the cycle of poverty by intervening now so that we can prevent this teen from requiring more services in the future. A great example of this is the cycle is the parents saying that marijuana is quote unquote natural. We often discuss the culture of poverty, and we can provide information that will impact whether or not it persists. So that's case study A. All right, let's go to B.
All right, B. I'm not a mom, but I can do my best here to read. I'm a mom receiving services from Marathon County's Nurse Family Partnership. I am 18 years old. In my past, I've had physical and sexual abuse, and I have depression and bipolar disorder. My highest grade that I completed in high school was 10th grade. My boyfriend and I live in a crowded, low-rent motel room with only other friends and family, and we're running out of money to pay for the cost of the room. We don't have a car or transportation, much less a car seat. I reached out to my NFP nurse because my baby was crying nonstop for 3 days. I don't know what to do to help my baby. What could Nurse Family Partnership do to help?
All right, so this is actually a situation that we dealt with recently, and I want to talk about it because it was really a huge success story for our Start Right program presently, and it is an example of the kind of thing we would see at NFP. So in a situation like this, our nurse is often able to see that patient that day. And in this situation, the nurse did an assessment and weighed the baby only to find that the baby had lost a lot of weight from the reported birth weight. Now, for nurses, that's an immediate big red flag. Babies should be gaining weight. They shouldn't be losing weight. So he had a weak cry. He hadn't had a wet diaper in over 8 hours. It's really dangerous. So the nurse was able to advise that the parents seek medical care urgently and help them problem solve how they would get to the hospital. So because they didn't have a car and they didn't have money for a cab. So the healthcare provider discovered that the baby was starving. And the reason why the baby was starving was because the baby was not able to get the formula out of the nipples in the top of the bottle. The bottles that the parents were using, for whatever reason, it wasn't working. So the baby was not able to get nourishment. So the staff at the hospital were able to get the baby immediately to take a bottle of formula, and an appropriate nipple was used, and it was recommended to the family to get different bottles. So as the family had no transportation and no money, the nurse from Marathon County Health Department was able to coordinate with other community agencies to get appropriate bottles for the baby. Baby has been gaining weight and is at a steady and healthy rate since then. So the nurse was really able to help the family find financial resources so they could not, they also found financial resources so they would not get kicked out of the motel room also. That's a big win. This is really a great situation because this baby's life was essentially saved by a nurse that went in and did this home visiting program. And I am happy to report that the dad is now working 2 stable jobs, and they hope to get an apartment soon, and the baby is gaining weight and is healthy. So that is a big success story. Okay, so we got our last one. Donna, you ready?
Yes. I am Hispanic, and I live in a rural area in Marathon County where I am being sexually trafficked. I do not speak English, and I do not have any resources or time to learn it and am kept isolated. I am not sure how pregnant I am exactly. I went to WIC, W-I-C, and WIC sent a referral to the Nurse Family Partnership as they thought there were more services that I could be eligible for. The nurse met with me and found out that I had no crib for our baby, and I was having difficulty getting enough food for myself during the week. I told my Nurse Family Partnership nurse that I did not go to the doctor yet because I can't afford it.
So in this situation, again, we're building relationships with the mother so that we can have this trusting relationship over a period of time. With situations like this, sometimes it's difficult because there's a concern that we will there's a punitive piece to this, that they're worried about getting caught or getting in trouble. And our job is to help individuals and get them into the right pieces of care. And so we build these relationships over a period of time. We support the mother. Our job is to provide the participants of NFP with opportunities to have healthy babies, to become safe and successful parents. In this situation, a nurse would work with the participant to help coordinate care with a medical provider. And we are knowledgeable, the health department nurses are very knowledgeable about safety net systems within our county. So we can refer them to medical care with systems that provide it for little or no cost. There are many times when participants do not understand the provider's recommendations, or some part of their care needs to be reinforced. That's a great chance for the nurse to be able to help them navigate the medical system, making sure that they have appointments, making sure they can get to those appointments, and then follow up to make sure that they made those appointments. And then also prenatal care recommendations in general. Our nurses can provide extensive education on healthy habits during pregnancy, what to expect when you give labor and during delivery. Those things are not necessarily taught, and sometimes they're a surprise for many women. And we provide information on what to expect when they go to the hospital. As these women do not have a lot of support or resources, our nurses are able to connect them with necessities such as clothing, car seats, a crib. Nurses are also able to provide them with information on community resources if they decide to reach out on their own in the future. So that is kind of a little overview of the common situations that we see with NFP or common patients that we would see. Yes?
Did I miss it, or did you mention something about getting her out of sex trafficking?
So with that situation, we would be working, depending on what we know and what information we have, we would work closely with law enforcement or social services or whatever organization that would be appropriate. On some occasions, we don't know for sure. We have suspicions, but we don't have any concrete evidence. So in some of those situations, it's not best for us to pursue because we are not the agency that would do the best with that. Best agency would be the police.
I heard that the women's community helps with that.
Yep. And we would make referrals to them.
Is this a common situation in Marathon County? Because I've heard some talks given on sex trafficking, but I've not come across any information or anything or people that's happened to. I'm not aware of it happening in Marathon County.
Yeah, I think that if you wanted some incidence or prevalence data, maybe the best we could have the women's community give that information. I don't have that information offhand.
Are there any other questions? Ron?
Thank you, Laura, for presenting today. You said something about there's a savings in cost to families or over $4,000. Is that per year, or is that national average? Is that state average?
So I can look up the study. It was actually the return on investment was actually $60,000 and some change. And I believe that the reason why $60,000, $60,428 per family served. I can pull up that study for you and send that to you if you would find that helpful.
Sure, if you could send it. Sure,
Absolutely.
great. Thank you.
I had a question going back to the scenario with the 14-year-old. So in that case, she's a minor, and there are other adults living in the household that we're visiting. Is there any interaction with the other people in the household? Like, in this case, she has parents, she's a child. So what is the interaction like with them in the education?
And I'll hand that one to Eileen, who is our home visiting expert, but you're going to need a microphone.
Can you hear me?
Yes.
The nurse right away will try to form a relationship with the child and the parents, understanding that they're one unit. And also the nurse isn't going to stay with them forever, right? It's the 2 years and then that's it. So she needs to include the parents in whatever is going to happen with the child after that. And so if they're engaged right away, then that really helps that. So yes, definitely.
Often the nurse works with parents, counselors, they work with a variety of agencies, and the whole point is to be this kind of strategic partner and help connect everybody. So it's a really cool program, if you ask me. But I'm totally biased, so.
No, thank you so much for sharing that with us. Is there any other questions? I don't know if are you watching online? If okay. Okay, is there anything else that you wanted to share?
No, that was you guys were the guinea pigs for the case studies. So
Great.
please let me know if that works well or if you think it's good for people to help them understand the NFP.
No, I do think it's good to help people kind of understand the
you can
different
keep-
scenarios that you guys could encounter. Thank you. Okay, then we'll move on to 7B, the Community Health Improvement Plan Overview. I believe Amanda's going to give us that overview today.
So I'm going to give Amanda her intro, as Amanda's the cameo guest star today. So as a level 3 health department, we are tasked with engaging the community on planning to determine health priorities for our community and how the health department can strategically assist in improving health. This process generally takes several months and involves key stakeholders from various institutions and backgrounds within our county. They work to identify health priorities and then discuss the strategies that will be used to improve or promote health. Our Community Health Improvement Director, Amanda Ostrowski, is here today, and she is no stranger to this work. She's done many, many cycles of this. And she has done a lot of community impact programming and facilitation. Amanda leads a dedicated team of health educators. And I like to talk about this because the name health educators is a little bit of a misnomer. The title doesn't really portray their expertise. Health educators are skilled community collaborators, facilitators, and they are all community health educator certified. And so what that means, it's a very specific certification. It means that they are all required to take a certain number of public health related courses, pass a rigorous test, and then continue with intensive competency requirements. So it's nothing to sneeze at. And I know because I had to take the test myself. So yeah, it was hard. So with her team of health educators, Amanda was able to facilitate a successful CHIP cycle and CHIP Community Health Improvement Plan. So hopefully, I'm going to try not to use that too much, but that's what we call it internally. Yeah.
Could you tell me what CHES means? Because that's that's part of their credentialing.
Yeah, that's the community, thank you. That's Community Health Educator Specialist credential. So that's the credential where they have to take a bunch of courses, public health related material. They have to do a very difficult test, and then they have to have yearly recertify through various competencies. So it's actually a pretty rigorous schedule. So with her team of health educators, Amanda is able to facilitate a successful CHIP cycle, and it was so successful, in fact, that the state asked her to present on our process as it was deemed extremely efficient, effective, and inclusive. So we were very proud of that. So what you'll see Amanda present today is an overview of the finalized CHIP, which was included in your packet. So I'm going to hand it over.
Laura, maybe you could hand out the shiny ones too, if anybody wants that instead. So as Laura indicated, since 1993, Wisconsin state statute required the development and implementation of local health plans to address the major health conditions affecting the residents. And so this cycle, which happens over 5 years, is called the Community Health Improvement Plan and Process, or CHIP. So the state outlines certain requirements that has to happen. So for example, myself or Laura could not just sit in our office and pick the priorities and pick the strategies. We have to do this in collaboration with community partners. I have to report on which community partners were involved in it. And it also includes a review of data known as the Community Health Assessment. So that's the first step in the CHIP. In Marathon County, our community health assessment is called the Life Report. Perhaps you've heard of it. If you haven't, you can go to marathoncountypulse.org, and that is where all of our community health assessment data is housed. In addition, it's required to develop goals, measures, and strategies to address the top health priorities. And we have to review and report on those annually in the subsequent 4 years of the cycle. It's also required that if a new community need comes to the surface in that 5 years, that we include it and resubmit to the state and report on that annually as well. So local health department CHIPs are on a 5-year cycle, and local health organizations like Aspires and Marshfield are on a shorter 3-year cycle. So what we try to do in the county is to align our processes so that the health department and the health systems are able to accomplish their goals together, because otherwise we're calling on the same community partners to do the same type of work. So you'll see Aspires and Marshfield Clinic heavily involved in this process. So as Laura indicated, the health educators on the community health improvement team are the ones that are carrying out this work. And we started this back, our first meeting for this CHIP was March 8th of 2020. And 4 days later, we were in a pandemic. So at that point in time, the Board of Health invited partners from the Healthy Marathon County Alliance to pick the top 3 health priorities. So they reviewed the data from the Community Health Assessment, and the Board of Health and Healthy Marathon County Alliance chose the health priorities of mental health, substance misuse, and health equity. Then there was a huge break of about 15 months where no work on the CHIP was done because of the response to COVID. Back then in June 2021, the Board of Health invited Healthy Marathon County Alliance back again to review the health priorities to ensure that the three were still relevant. And what they found was, were they not only relevant, they were actually even more important now in 21 than what they were in 2020. So after they were reconfirmed as the three health priorities, we moved into a process called results-based accountability. This is a process that is being picked up by health departments across the state in order to complete the CHIP in a way that looks at basically the community partners within the county doing the best work they can to address the issue at hand. So what that looks like are very strictly facilitated processes that address the root causes and factor analysis as to why something is happening. And if you're really interested in RBA, I can talk about it all day. We can have a side conversation. But what you will see on the insert within the pamphlet is essentially our CHIP plan. So the result would are our goals. The indicators are what we will be measuring over the next 4 years. And the strategies are the tasks and activities that will be occurring in our community over the next 4 years. What's important to know is that all of these strategies will not be led necessarily by the health department. The community partner who is best poised and most responsible are the ones that will lead this work. And that's really critical because there are areas that the health department wouldn't be effective in leading. And so we're going to let other community partners do that. You'll notice on the back of your packet, these are all of the community partners that participated. So this is an agency listing. There's 35 agencies here. We actually had many more partners. Each of these agencies had an average of 1 to 3 people who participated. And we facilitated this completely virtually. There was no in-person option, which is something that was a huge task when we started it in February of 2022. But what we found it did was it allowed people from across the county who had never participated before to contribute. And we had such synergy across the health priorities that work began on implementing these strategies before the CHIP was adopted. So an example that I can share with you that you will find, let me just find it here. So on the blue side, which is substance misuse, and the third strategy, or excuse me, the third indicator and the second strategy is recommend the use of life skills curriculum within high schools to strengthen coping strategies. So what the substance misuse group found was that it's no longer about prevention of a single illicit drug. It's not about preventing alcohol use or preventing marijuana use. It's about preventing use of all of those substances with a single strategy of teaching the coping skills. And so schools have begun to look at the implementation of how they can do these life skills curriculum. They started that back in August, September, and now just yesterday, one of our healthcare partners actually announced funding to pay for high schools to be able to implement that. And so now that's how we see the synergy working. So there's 3 or 4 community partners working on the one strategy, each doing what they can do best, right? The healthcare systems can pay for it, the schools can implement it, and the health department can help track the performance measures. Anything that I missed or any questions?
Thank you. Do you know when you'll have some data to present based on your strategies and indicators?
Mm-hmm. So if you want the data for the indicators, you can go to Marathon County Pulse and find all of the data for these indicators. The performance measures for the strategies will be available at the end of 2023. And the next community health assessment or the life report will be released probably June 2023. That lies with United Way of Marathon County. So I don't want to speak too firmly on their timeline, but somewhere around there.
And I really want to encourage everyone to take a look at that Marathon County Pulse website. We went over it I think we've looked at it a couple times at the Board of Health meetings, and it's really, really great. And it is very nice to follow along. You can click different things, and it brings you to the different data and kind of the trends of it. So if you go on there, you'll be able to figure it out. Yeah, go ahead, Donna.
Thank you. I did go on there, linked, to all of the areas that are planned for that they're working on. I was a little disappointed, though, and it might be because of COVID being blocked out, those years being blocked out, but I was a little disappointed in the fact that some of the information that was given was quite old, like 2007, 2011, 2015. And so now we're getting into 5 to 7 years old data. And I'm just wondering why is there more recent information, more current information available? And if there isn't, why not? Thank you.
So it depends on the source of the data. One of the best sources of data we have right now is the Youth Risk Behavior Survey. It's done by local high schools and middle schools, and it's done every other year. It's administered by DPI. That's the most frequently updated data that we have at a county level. There's also county level data that comes from the departments of this county, like the Sheriff's Department, Highway Department, Social Services has indicators on there. Those are also really great indicators because we have control of that data and we can access it when we need to. Data that takes a long time, that comes from the American Community Survey or Wisconsin Interactive Statistics on Health, which is the state, they not only take years to update, they also tend to chunk their data in blocks of 4 to 5 years. And so what's on Pulse is the most up-to-date data that we have available at that time.
Okay, thank you. And I know that we're covering students here, but are you going to be talking about some of the other areas that you focus on?
Sure. Do you have an area of interest that you want me to talk about?
Yes, oral health and healthy needs of aging, which I see you're the contact person for.
Yep, so those are actually from the past CHIP cycle. So health needs of aging was identified in the previous CHIP cycle. And based off of the data that we had, it didn't rise to the top as what the 3 other priorities did for Board of Health and Healthy Marathon County. ADRC is the lead agency for health needs of aging, but it's not a community coalition anymore. So these health priorities change in the 5-year cycles, and health needs of aging and oral health are 2 of them that fell off, as did healthy, I can't remember if it was phrased as healthy weight or healthy eating, active living. So it all depends on the community context on whether or not the health priority persists into the next cycle. And so those 2 did not. So the 3 that did were substance misuse, mental health, and health equity. So those are the 3 health priorities that our resources will go towards this cycle.
I can understand that. Does that mean that these items that are listed, like healthy weight was one of them, housing is another, or were those eliminated too?
Yep. So one of the biggest success stories that we have actually is around local food systems. That was identified in several community health improvement plans for probably decades in Marathon County, that we needed to expand our local food options in order to impact obesity. And Michelle was part of it, Chris was part of it at one time, but we were able to implement a food system within Marathon County that essentially the need for the coalition ceased to exist. And so you want to see that happen. You want to see health priorities kind of slip off the radar because it means that what we've done was successful.
I noticed in the housing that it said that the percentage of elderly, the percentage of their income that's being used for housing is 60%, whereas the average is like 30 for those that aren't elderly. And I know there's a big outcry now in the area of elderly health care for eyes, ears, and dental, that's because of lack of insurance coverage, that's being neglected, their health is being neglected.
I just wanted to mention that even though, if something doesn't rise to, if there's a health priority that we at the health department feel is important, that doesn't necessarily rise to this, we still provide some resources to it. It's not necessarily as resource intense as the other ones. I think that a good example would be the mitigation efforts that we took around PFAS, or polyfluoroalkyl substances that were in the water this time around last year that came out. We had to devote some resources and some time and energy into ensuring that everybody had messaging around what those substances do in our water. And so that would be a good example of something that doesn't necessarily rise to the need of the community health improvement plan, but we still devote resources to it. And the other thing is that there are other agencies out there that devote resources to some of what you're saying, like the ADRC does quite a bit of work for the aging population for various health-related priorities as well.
Are there any other questions? Do you have more that you'd like to share with us? I thought you guys were going to go for hours.
Are we boring everybody?
One last thing. So, as I alluded to, it is a requirement if something else bubbles up that we include it within the CHIP. And so something that will be coming, we already have an update for 2022, which will be the addition of the child care crisis to the red piece down here, which is health equity. We're addressing health equity through the social determinants of health. And so housing is part of that, childcare is part of that, access to medical services is part of that. And so, Donna, as you indicated, healthcare access for seniors isn't here, but in 6 months it might be. And so it's a dynamic document that will continue to change as we go through the cycle.
Great. All right. Thank you guys so much for sharing with us. And again, I want to encourage everyone to go to the Marathon County Pulse website, because there's some great information on there. And I think it really helps pull all of this together and maybe provide a little more context for where this information came from.
Absolutely. And we'd be available if somebody wants us to walk them through the Pulse website. We're available for that. So I know that some county board members have asked for that and found it very, very helpful. And we would set you up with our expert at the health department who takes care of our Pulse website. But it's a really amazing resource. And we could really talk about it for hours, but I think you probably have other things you want to do today.
Thank you. Okay, we'll move on to 7C, then the update on recruitment for Social Services Director. And we have Administrator Leonard.
Good afternoon, everybody. I will be brief. I won't go for hours, although, Krista, you said you're going to talk for an hour? I'll be brief. As you all know, I announced it at the last county board meeting, we had a number of department heads that were moving on to either another role or were retiring, one of which is Vicki Tilka, more than 30 years of serving Marathon County in a number of capacities. She's been our social services director for a great long period of time. She now, I think yesterday was her first day over at North Central Healthcare in her new role as the managing director of community programs. So wanted to give you an update as, hey, what are we doing to fill that very important role? And I have great news. Krista Jensen, who is seated to my right, is serving in the role on an interim basis as the social services director, and wanted to just give in speaking with Chair Van Cray, she asked for just an update, kind of what the recruitment process looks like for department heads. So under your rules, that's probably my biggest job, is to make sure that the organization has very skilled, talented, and knowledgeable people, high character people, providing services and supervising our staff. And my process for doing that is a pretty standard recruitment process. So this week, I hope to really take time to review that job description. In fact, I should be getting it from Employee Resources. I asked them to do a little work on it already. I'm going to sit down with Krista and we'll talk about, make sure that, we do this every time we have a department head recruitment. Even if we looked at this last year, we're still going to look at it again, make sure it really captures the work that needs to be done, the priorities that we have, and the priorities that the board has in terms of ongoing work. We'll post that that position. It's an open recruitment. We post in a number of different ways, but all the ways that very important roles in all sorts of different organizations get posted. We will screen those applicants once they come in. My thought in terms of recruitment is a 3-week recruitment right now. I've already reserved some time for the first round of interviews, but our process is a very inclusive process in terms of screening, bring in candidates, do that initial round of interviews. I don't make any plans past the first interview because you never know what you're going to get. Frequently, however, that process entails a second round of interviews. My general practice for department head recruitments is that I not only have staff, myself, Chris participate in those HR representatives, but I also frequently bring in county board members from the executive committee or a standing committee that the individual would report to. So I'll probably be reaching out to make sure that there's not only engagement from the county board, because as was the case with you had Laura giving a presentation today, Laura and Amanda. You're going to be working with the future social services director, so I want you to be engaged in that process, but also be knowledgeable about it, right? I mean, I hope that you trust a lot of the work that I do, but I want to involve you so you see the amount of work and energy that we put behind that process. My hope is to, again, conclude that first round of interviews in the month of February, kind of the middle to latter half of February. And then I'll be able to announce to the county board what kind of those next steps look like. But great news. Again, Krista's been with us. She's almost 8 years, came to us with a great deal of experience in social work. She was the initial assessment supervisor before becoming the child welfare manager, a position she's held for a number of years, and now is serving in that interim capacity. Just for your own little bit of context, with the social services department, they have a number of divisions within that department, but certainly child welfare, not only in Marathon County, but across the state of Wisconsin. That is the lion's share of work when we talk about social services. Child welfare, it's very difficult work. When you talk about, Laura was giving you kind of the scenarios that you'd see with the nurse-family partnership. True success for the nurse-family partnership is keeping Krista from half of that. Go talk to Corporation Counsel's office to do a CHIPS petition, a child in need of protection or services. That's that situation. That used to be my job when I was the deputy administrator. I handled those cases. Krista was the initial assessment supervisor. We met every week to talk about kind of how things were going. So they get the calls when we have a failure to thrive child and a parent is not doing what they need to do. And it's great, all the things we can do to get that education, drive that education down to parents, those supports so that social services doesn't need to get involved and take a kid out of a parent's home or even keep the child in the home, but do those things through a court order is true success. So Krista's experience in the child welfare side, I think, puts her in a very good position to lead the agency. We also have a number of other people in leadership positions that I'm very confident. This isn't a recruitment I would tell you if hey, we need to go out and move very quickly. Krista I have all the confidence in the world in her and the rest of the team. One of the other things we'll do, just based on, I like to do this every time we have a new department head, is give them time to assess whether or not we need to make changes in terms of the kind of organizational chart, right? When you have I like to use analogies. You guys have probably seen that already, but when you have a sports team, right, and one member is out of the lineup, you don't just act like the next person necessarily is plug and play. They're not all the same. And it's a good idea to take stock of, okay, what skills and talents do we have? Should we perhaps realign some duties? And we'll do that once we have that recruitment completed. But like I said, my hope is to have certainly the first round of interviews completed sometime in the month of February. But if you guys have any questions for Krista, feel free to grill her now.
Thank you, Lance. And thank you, Krista, for being the interim director. I know that is stressful. Are there any questions for either of them? Okay. Great. Well, then I think we're on to item number 8, next meeting time, location announcements and agenda items. 8A, committee members are asked to bring ideas for future discussion. 8B, next scheduled meeting is Wednesday, February 1st, 2023 at 3 p.m. And item number 9, adjournment. Have a motion? Okay, motion by Cavelli, second by Krause. All those in favor say aye. Aye. All right, we are adjourned. Thank you.